Hi, my name is Dr. Kobylianskii, and I'm a fellow in minimally invasive gynecologic surgery at Mount Sinai Hospital in Toronto, Canada. The aim of this video is to discuss the importance of treating anemia prior to gynecologic surgery. You may be wondering, you've been diagnosed with anemia, what is it? Anemia means low hemoglobin, which is a protein in red blood cells that transports oxygen around the body. When your hemoglobin levels drop below normal, your organs are unable to get the adequate amount of oxygen that they require. The low hemoglobin can lead to many symptoms and impair your ability to do normal daily activities. These symptoms might include feeling very tired or fatigued, feeling weak, shortness of breath or breathlessness, rapid heartbeat, dizziness, fainting, headaches, feeling cold, difficulty sleeping, and even restless legs. It is ideal for people to go into surgery with a hemoglobin level greater than 120 grams per liter. Your doctor would have tested for this. You might be wondering, why do I have anemia? Most of the time, anemia is due to low iron. This is known as iron deficiency. Iron is an essential mineral that your body needs for growth and development. It is an important component of hemoglobin. Without iron, your body can't make enough of it. 1 in 4 people planning to have major gynecologic surgery, like removing the uterus or a fibroid, have anemia, and it's usually the iron deficient type. This makes sense because every time you have a period, you lose blood, and with it, iron. For many of these people, it is more iron than they're able to replenish through their normal diet. And why does it matter so much? Well, many studies have shown that people with anemia that are planning to undergo gynecologic surgery are at risk for serious additional health problems. They are more likely to get an infection, have poor wound healing, and have a longer hospital stay after their surgery. They're also at increased risk of other complications, of needing to be readmitted to the hospital even after they're discharged. They may also feel very fatigued as they recover from surgery. And finally, they're also at a higher risk of death in some cases, although of course this is very rare. They're also 4 times more likely to require a blood transfusion around the time of their surgery. Now, why is blood transfusion a problem? Well, blood transfusions themselves carry significant risks. And for people who want to have children after surgery, transfusion can make pregnancies more complicated. Because of all of these reasons, it's very important that we diagnose people with iron deficiency anemia before surgery and treat it. I like to use the bathtub analogy for treatment. Our goal is to keep the bathtub full of water, in other words, your body full of blood. To accomplish this, we usually need to do 2 things. First, we need to plug the drain, stop or reduce the monthly heavy bleeding if there is heavy bleeding. And second, we need to help replenish the water by treating iron deficiency anemia that may exist. Another video that we made focuses on how to plug the drain. Our next video will talk about how to replenish the water by treating iron deficiency anemia through oral and intravenous iron. This can be done while you're waiting for your surgery date to come up, and usually takes a few months. A common question that we get from patients is, will eating more iron-rich foods help? Well, while eating an iron-rich diet can help to prevent iron deficiency anemia, an average person's intake of dietary iron is just not enough to fix anemia once it has already developed. There are 2 main types of iron that are found in our diet: animal or heme iron and plant or non-heme iron. Just so you know, foods rich in heme iron include lean red meat, chicken, fish, pork, and shrimp. Foods rich in non-heme iron include beans, leafy greens, dried fruits, eggs, wholemeal bread, and iron-fortified breakfast cereals. Again, the food sources are just not enough to fix iron deficiency once it has already developed. You will require iron supplements.